Hello doctors, welcome back. In this video lecture we will discuss the anatomy of the subclavian artery. So student, the subclavian artery on the left side arises from the arch of the aorta or the aortic arch. As you can see, this is the aortic arch and this is the subclavian artery. While student, on the right side it arises from the brachiocephalic trunk. This is the brachiocephalic trunk, and the same brachiocephalic trunk arises from the aortic arch, and then the brachiocephalic trunk gives rise to the subclavian artery. This is the subclavian artery. Student, this subclavian artery ends at the lateral border of the first rib. This is the first rib and this is its lateral border. This is its medial border and this is its lateral border. So on the right side, the subclavian artery arises from the brachiocephalic trunk and ends at the lateral border of the first rib, while on the left side this artery arises from the aortic arch and ends at the lateral border of the first rib. Now student, going toward the branches of the subclavian artery. So the subclavian artery gives rise to the vertebral artery. This highlighted artery is the vertebral artery. Student, this artery supplies the muscles of the neck, vertebra, spinal cord and the cerebellum. Now student, the second branch of the subclavian artery is the internal thoracic artery, and this artery supplies the structure of the internal thoracic region. Now student, the third branch of the subclavian artery is the thyrocervical trunk, and from the thyrocervical trunk the inferior thyroid artery arises and it supplies the inferior part of the thyroid gland. And the second artery that arises from the thyrocervical trunk is the superficial or superior cervical artery. This is the superior cervical artery, and student, this artery supplies the trapezius, levator scapulae, rhomboid muscle, sternocleidomastoid muscle. Now student, the third branch that arises from the thyrocervical trunk is the suprascapular artery. The suprascapular artery supplies the infraspinatus muscle, supraspinatus muscle and the shoulder joint. Now student, the another branch of the subclavian artery is the costo-cervical trunk. Student, this artery supplies the costal region and the cervical region. Now student, to overview the subclavian artery. So as we have discussed, this is the ascending aorta, arises from the left ventricle of the heart, and then this is the aortic arch. So from the aortic arch, this is the left subclavian artery, this is left common carotid artery, and this is the brachiocephalic trunk, and the brachiocephalic trunk gives rise to the right common carotid artery and the subclavian artery. So we will discuss the branches that arises from the subclavian artery. So the first artery that arises from the subclavian artery is the vertebral artery, and this is the internal thoracic artery. Here it is the thyrocervical trunk. So from here, this is the inferior thyroid artery, and this is the superficial cervical artery, and this is the suprascapular artery. Now student, this artery, this is called the costo-cervical artery. So here we will overview the branches of the subclavian artery. So the internal thoracic artery, which supply the thoracic region, the vertebral artery, which supply the vertebra and the muscles of the neck, the thyrocervical trunk, which then give rise to the three branches: the inferior thyroid artery, which supply to the thyroid gland, and the superficial cervical artery supply to the trapezius muscle, sternocleidomastoid muscle and the rhomboid muscle, and the suprascapular artery, which supply to the supraspinatus and the infraspinatus muscles. Then the fourth artery that arises from the subclavian artery is the dorsal scapular artery, that supply to the rhomboid, latissimus dorsi and the trapezius muscle. The costo-cervical artery, as its name indicates, it's supplied to the costal region and the cervical region.